Hi, today I want to talk to you about treatment for the infraspinatus muscle, which is one of the rotator cuff muscles. The infraspinatus muscle is involved in all shoulder, arm, hand problems and often with stiff neck problems. It is a very thin, flat muscle that can harbor a lot of trigger points and can also be quite painful to treat. So just to get a look at the surface anatomy of the infraspinatus muscle, if we take a look at Val's scapula, okay, the outlines of the scapula, and then come up and find the spine of the scapula and run your thumb firmly along underneath the spine of the scapula. The infraspinatus lies in the infraspinous fossa of the scapula, right underneath the spine of the scapula, covers the whole posterior aspect and comes and attaches on the greater tubercle of the humerus. So when you're searching for infraspinatus lesions, you want to make sure you cover all of the tissues along underneath the spine of the scapula. So going very slowly and feeling for any adhesions. And also along the medial surface of the infraspinous fossa. And you can possibly see how I just kind of bumped over one of the lesions there. I don't know if you could see it twitch on the camera. And also right along the axillary border of the infraspinatus. So when you're first starting, you're going to use a fairly flat surface contact. It can either be the heel of your hand or a soft fist, or to be more specific, a flat thumb. So once you've done your detective work and found a couple of adhesions that you really need to work on, you're going to do a more specific deep technique in order to release those adhesions. So this technique is an active release. So I'm going to get the patient to work together with me to perform this technique, which makes it easier for me as well. So first of all, I'm going to slide along the infraspinatus and find an active lesion, which is right there, because as soon as I hit it, Val had a twitch response. So I'm going to engage that adhesion firmly, but not too hard. I'm going to ask Val to slightly bring her elbow down, which contracts the muscle, and then stretch her arm out fully, turning her thumb down towards the ground, and then relax. Okay, so just to demonstrate that again, I'll try to use the other hand so you can see a little bit better. I'm going to slowly slide and sink into an adhesion. I can engage the other thumb on top just to brace the one that's doing more of the work. And Val, you're going to bring your elbow down, that's far enough, and reach, stretch, 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 turning your thumb down, stretch, and relax. Now the more that Val stretches, the more the trigger point is going to hurt. So the patient really is in control of the pain, which is nice for them. So again, I'm going to find another adhesion. So I'm slowly sliding until I find a tight tissue. I'm going to hold that tissue, get Val to bring her elbow down slightly to contract. Come on down, Val. That's good. And then reach and stretch with your thumb pointing down. Stretch, stretch, stretch as I firmly hold that tissue. The infraspinatus has a very large referral pattern. It's going to refer into the anterior and lateral part of the shoulder and down your arm, right into the forearm, and often possibly into the hand. So it can cause problems with the extensor muscle group of the hand and even end up being a decrease in grip strength. Infraspinatus trigger points also can refer into the suboccipital area and are often involved in a lot of stiff neck issues too. So you really need to treat the infraspinatus or investigate the infraspinatus tissues if you have any kind of a shoulder problem or an arm problem or a hand problem, and any time that you're working with stiff neck. The last thing I'd like to show you today is a test for testing the range of motion of the shoulder. The reach back test. If it's full range of motion, you should be able to reach up to the spine of your scapula. If you have a tight infraspinatus, you might only be able to reach into your back pocket and really have a lot of difficulty reaching up to, like, say, undo a zipper in the back. So the infraspinatus muscle is explored in great detail in the Advanced Shoulder Rotator Cuff Technique course. My name is Cheryl Stevenson, and this is part of the Perfect Balance seminar series. We'll see you again soon.